Okay, well, welcome everybody to this inaugural meeting of Medical Women in Technology and Health and Australian Federation of Medical Women. I'm the President, welcomes our guest speakers tonight to the podium and for providing their time and their wisdom and skills and sharing their information and knowledge and experience with us all who are on various parts of the digital health journey. I'd like to acknowledge the traditional owners of the land on which I'm on, which is the people of the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and emerging, and acknowledge any Indigenous members who are attending here today with us also. Now, tonight is really about democratising opportunity to learn and engage with leaders in an industry which you'd otherwise not come across in your day-to-day life. And I personally invited Louise and Amandeep for their exceptional vision and leadership in an area that is proving to be the next big industry, global industry on the planet, that's going to really change the way we interact with patients and the way health is managed moving forward. We're living in an age where populations are aging, not just in developed countries, but in underdeveloped countries. And there's a whole conversation happening about democratising access to internet and digital health. And we're looking here at how this industry is evolving, and it's still in its infancy. So even though we're using a lot of technology day to day, we're still in that infant stage of this whole opportunity. And I think that it's a really good time for medical women to be throwing themselves into this space at any stage in our careers. And I've invited these two keynote speakers to share with us how this might be possible for us, and to also give us some information around their backgrounds, their journey, and what's happening out there that, you know, ties in with where we're at in our various stages. So I'd like this to become like an ongoing conversation that we can have within between our organisations as members of AFMW, and also with Australasian Institute of Digital Health, and Amandeep, and all the wonderful organisations that you're tied up with too, and the Australian Digital Health Agency too. So a bit about our first speaker, Louise Schaper. Now, Louise Schaper and I met many, many years ago at HISA. I think it was a HISA conference. It was somewhere in St Kilda at the Novotel, I think. And it was then Health Informatics Society of Australia. And Louise was already eons ahead in the space, and was definitely someone to watch, and has become the CEO of the Australasian Institute of Digital Health, and has gone from being an occupational therapist to a PhD graduate in informatics, and she's gone out solving problems that others have also had but haven't been able to solve, but in very unique ways, and using the tools that industry are using out there that are now being adopted in the medical industry. So Louise, over to you, and thank you for coming.
Oh, cool. Thanks for the invitation. And I'm so glad to see so many people joining us tonight. And yeah, if you're going to have regular forums, I'd love to just join anytime. Magda, would be wonderful. So feel free, if you guys, you're having your dinner or you've got some gin and you don't want to have your camera on, that's completely cool, of course, but also like feel free to have your camera on. I like the informality of this, and it's nice to have so many of you in my home right now as well, and in your homes as well. So thank you. Shall I just say a little bit about how I got interested and involved in digital health? Yeah. So as Magda said, I did train as an occupational therapist, although a qualifier is I never got a paycheck as an occupational therapist. I planned to, that was very much my plan, but I graduated, and because I'd been spending the previous 4 years of my undergraduate degree talking to people about we need to use computers in healthcare, and everyone just thought I was nuts. A telehealth project came, someone was literally just using, this is so random, isn't it, how career things happen. So my plan was to finish my honours thesis, and I even had a job sort of lined up And but because I'd been talking about computers for so long, someone was using a spare office in the occupational therapy building. And because I'm such a nerd, I was always there hanging out with lecturers. And apparently this person needed a research assistant, and they said, Louise will do it. Louise, why? And it was about telehealth, and it was actually evaluating the WA telehealth program back in the year 2000, 2001. So I said, yeah, sure, I'll do that for 3 months, and then I'll go be an occupational therapist. Well, that was 2001. And as I said, I never received a paycheck as an occupational therapist. And they kicked me out as well. So I'm officially not allowed to call myself one. Interestingly, while I was teaching occupational therapy, that was okay. But the moment I became the CEO of what was then called the Health Informatics Society of Australia, I was told I was no longer able to maintain my registration. So I'm going to fix that problem as well. It's nurses have that problem. A lot of clinical professionals who specialize in digital health have that problem. But anyway, so that's so I asked lots of questions, and I was telling a story earlier, and no one could give me an answer. And so I ended up applying for a scholarship and won that scholarship. And I thought, right, I'm just going to find out the answers myself. And so I was like, and I literally went and thought, because I didn't have the language at the time, so I thought, I want to know why aren't clinicians using computers? And through my searches, I discovered this field called health informatics, and I still remember being so excited that it's not just me alone and my house in Perth in a university with nice people, but they just think I'm a freak, because no one wants to talk to me about the things I want to talk about. And I discovered there's actually an entire global community of people who specialize in this space. And I was like, that's where I need to be. I joined, it was so early on, I joined as a member that I could email them, but they had to send me a paper form to fill out and send back. When I became CEO, we were still doing that, and I changed that. That was my week 1 job, is, you know what? No, we're going to have an online form. So, that was 12 years ago, I became the CEO. The name change, just in case that's confusing to anyone, is that 2 years ago, we convinced the members and fellows to join and merge with another organisation, the College of Health Informatics. So we merged, I retained CEO and retained my wonderful staff, and we renamed ourselves to the Australasian Institute of Digital Health. But yes, now I have a PhD, so apparently now I'm supposed to know what I'm talking about.
And you do, which is why you are here to share with us this amazing opportunity. And I'm going to make you a co-host here,
Oh,
so that
cool.
you can share your screen when you choose to, and when you're ready to, and launch into what you're proposing for for medical women, and what you see the opportunities are.
Absolutely. Okay, so you guys see my screen?
Yep.
Yep, with me in it. Okay, great. So don't worry, this isn't death by PowerPoint. Oh God, I hope not. So when we talk about digital, look at this ecosystem. I'll put myself there so you can see, and this isn't every single company and every single organization. This is really just a representation. So digital health is really at the center of the healthcare universe. We deal with clinicians, researchers, students, people who are the technologists, executives, people who run the healthcare system, policy people in government, startups and innovators, insurance companies, the list goes on. And if I had a slide like this, even 5 years ago, to be honest, I don't know whether people would have bought it. I think people would be thinking, yeah, right, Louise, because it used to be a much smaller community of people going, digital health is really important. And but now we're finding we have, even since COVID hit at the start of last year, we thought, well, people have busier things to deal with in their personal lives and their professional lives. So we expected a real downturn in membership growth and people taking our education programs. And instead it's skyrocketed. We've never been busier. We've never had so much growth in such a short period of time, which is good, obviously. Just to let you know, this is just a high level overview of our strategy. The detail isn't important for tonight, but just so you know, we're basically Australia's peak body for digital health. So individuals join, as I said, as well as organisations, and it's a really, really broad church. Sometimes I wish I ran the RACGP, just so when people said, what do you do? I could go, I represent GPs, and just full stop. Whereas it's very difficult to give you a summary, give you an elevator pitch, because the community is really diverse. But in terms of what we focus on, like a lot of professional groups like this one, people join really because they want networking and professional development. And so we provide, like we used to obviously run in-person events, and we will be back to doing that come early next year, I hope, given the strength of the vaccination progress. Which some of you are probably working on, and I know Amandeep is working on a lot as well. So we do a lot of work on workforce advancement and really building up the capability of everybody in the healthcare sector. So it's not just the people who specialise like myself and Amandeep, but it's really like, okay, well, you're a surgeon, you're a nurse, you're a physiotherapist. And, we don't all have to be digital health specialists, but what is it that you guys need to know to be the very best physiotherapist you can be? What is it that a nurse needs to know about digital health to be the very best nurse that he or she can be? So our workforce programs are growing substantially. We've got a lot of new things on the books for next year, but I've just picked one to tell you about tonight. So we'll go to that in a second. So yes, we have a whole workforce, and there's one of our nurses actually. So this is the program that I thought I would just let you know about. And aside from our board, you guys are the first ones to hear about this. So we haven't officially launched it yet. So I'm not sure, Crystal, my colleague, is on the line, so she can tell me if we're allowed to tweet about it yet. But you could say that maybe you're hearing about something really exciting. Stay tuned. But and thanks to our partners as well. So we had this idea. It was actually one of our board members, Wendy Chapman, who some of you might know. She's at the University of Melbourne. And Wendy came over to Australia towards the end of 2019, which sounds like a lifetime ago now. And in America, she was involved in the sister organisation of the Institute of Digital Health. And over there, she started a program for women in digital health, and it's a leadership and mentoring program. And she came to see me and said, could we do this in Australia? And my default response was, hell yeah, excellent. Let me merge this organisation, and we launched it in February 2020. And then this be the first new thing that the Institute does. And here we are 2 years later, because this little thing called a pandemic happened, and it derailed everybody's plans, including ours. So the nature of the program is it's multifaceted. So there's leadership and mentoring, and the aim is to really be able to spot people who are really keen in this space. And it's at various levels. It could be someone who is still relatively junior in their career, but they know they want to pursue a career in digital health. Then this is the program for them. You might be very senior in your field, but again, there's ladders that you want to step up the rung in regarding digital health. Well, this is also for you. So we want it to be a very inclusive program. These are just the highlights of, I'll put myself there over my picture. So we have a governance body, and it's headed up by these wonderful women here. And we really are getting started. We literally have not had a meeting with all of these people. I've had meetings with them individually, but not as a group yet. That's how new it is. And in terms of what the program is made up of, because of the American program, everyone has just been so generous, so that the program that has run in America, and they've done it for a few years now, so they've had learnt lessons along the way about how to improve it. And so we get to pick it up and bring it to Australia. And over the next few months, we're actually going to be contextualising the content and looking at what needs to be modified to remove any cultural discrepancies between our two countries. But there are learning sessions, formal and informal. There's a lot of self-directed learning, group study. Executive coaching is a real highlight. So the program will be employing two executive coaches who will work with every single person in the program on a one-on-one basis for the duration of the program. And the program goes for, I think we're still working it out. It was 6 months, but then I saw an email the other day that there was a meeting and they're thinking it'll be an 8-month program. So 6 to 8 months, something like that. what we want to do is make sure that the benefits to being involved in this leadership program are not just for the women participants themselves, but also for the community and the field of digital health as well. You know, we all know that we could do a lot better in getting more diversity around the table, and that's something, for instance, out of one of the goals that we're hoping this program delivers for our field. Here's just a few quotes from some of the American people who took it. And what I thought was really interesting, and thanks to my wonderful colleague Crystal who pulled this together for me, that you can see that in this selection of 5 quotes, people are getting what they need out of it. So, you know, like the orange quote, you know, someone wasn't very sure, you know, they probably had a confidence issue, and now they're not just confident, they're actually really excited about doing it. You know, one of them is learning that that how the leadership program has actually been really essential to increasing the role at a population level for women in digital health as a cohort. So and we're hoping as well that it'll lead to all sorts of things. So we aim to make some scholarships available. So because there is a cost to participate, but you know, there's a big discrepancy versus, you know, like, you know, I'm a CEO and but of a relatively small organisation, and so maybe I get benefits out of this program, but I have a CEO salary. There are people who earn less than $100,000 a year, where, you know, the cost of a program might be a bit too much for them, but they could really benefit. So we want to make sure that we can provide scholarships, whether that's full scholarships or it's part funding as well. So the committee is now working out, you know, the eligibility criteria for those types of things. But once you've gone through the program as well, you get to be part of the alumni and be part of the wider digital health community. But hopefully you've grown and had a lot of really important relationships through your involvement. And detail not important here, but just to let you know that, you know, this was a high level timeline. So we're working on some of those back end things now that we're sorting out. The plan is that we will launch it. Some of you might know that Telstra Health have a Women in Digital Health group. And this year they've launched the Women in Digital Health Awards. And I'm a judge on that award. It's been a thrill to be involved in that. So I'll make sure, Magda, you've got a link to that if you're not already a member, so then you can distribute it to these people. Because we're going to have an awards night. It's going to be really fun, and that award will actually highlight 25 women. We received about 150 applications, so it was a really tough job as a judge because we had to select only 25, and they were all amazing people who would be highlighted, and we were looking for a diverse mix in those 25 as well. So we're excited about that. And the first intake of candidates will be in the new year. So the first cohort of people to go through this program will be in 2022. There you go.
Brilliant. That's fantastic. Thanks for that, Louise. That's a really exciting opportunity to sort of venture into a space and find yourself a mentor and be taken along a journey with some exceptional people who are experts in that area. So with respect to how we get in touch with you around that, what would you recommend, Louise? So, I mean, you and I have shared, you've shared this with me. We had a chat about that at our session, at our, you know, chat. What would you suggest we do for next year in terms of engaging AFMW and the medical women that our medical women know too, that might benefit from getting some of this experience?
Yeah, well, and thank you. So I would say that certainly just, you know, keeping connected. So once we're going out to market, I guess, with a call for people to apply for the program. Even if you guys get that and you think it's not for you, but you know 10 women that might be, like, please forward it on. And we have no idea. It's the first time this has been done, right? So are we going to, you know, get 50 applicants? Are we going to get 150? Are we going to get 20? Who knows? I actually anticipate we will be oversubscribed, and again, it'll be hard to work out who the first group of people. But, you know, if it's oversubscribed, one, we could look at what else we can do for the people who might not be in the program. So which could just be connecting to the networks that Amandeep and I run anyway within the digital health community. But the other thing is, if there's a real big demand, it'll actually help me build a case to sponsors that, look, you guys are going to need to put more money in, or we're going to need to find more sponsors, because, you know, if there's this much interest, we want to be able to cater to as many of these people as possible. I think that'll be a nice problem to have.
Fantastic. Really excited, Louise. So I'm going to now introduce Amandeep Hansra, who is a fellow GP, practicing GP, who has so many hats and feathers in her hat, both in the digital sector and is currently, well, you were the CEO of Telstra Health, weren't you, at one point, Amandeep? Or am I incorrect in that? Advisor to CEO to Telstra Health.
Sorry, I lost my mute button. Technically a challenge today. I was the CEO of Telstra Medicare. I'm going to go through my story a bit, Magda, so you don't need to do it.
Fantastic. I'll launch into it, Amandeep. Excellent.
And my apologies to the people in the audience that I know that probably know my story. So if you don't have to sit through it, but I just thought it would be good to kind of share. I think, Magda, when you came to me and you said I'd like you to come and talk, I was kind of a bit torn about whether I talk about two different passions, really, and one obviously being the digital health side, and then one being the creative careers in medicine, which encompasses digital health, but is also broader than that. And then when I heard Louise was speaking, I was like, great, I don't have to talk too much about digital health because she's a digital health guru, and I will focus on the other side. But it'll be, I think I'll just touch on everything in having a talk. So sorry, Magda, I just cut you off there.
Yeah, no, fantastic. You've got the floor. So yeah, we want to hear.
Can I share?
Yep, I'll make you a co-host. Sorry about that. I should have thought about that earlier.
Should be able to share anyway.
Okay, yeah.
You can?
Yeah, just a second, sorry. Now I'm not gonna, can you see my screen?
Yep.
Okay. Oh, no.
No, not yet.
Oh, hang on a second.
Yep, now we can.
Yep.
Okay. So apologies, because I'm not as fancy as Louise, and I'm not going to be on your screen. But Louise, you're going to have to type in the chat to everyone. I know there's a way, you've talked to me through this before, about how you get yourself on the screen. But you might have to type in the chat to tell everyone else, because it's the coolest trick ever to have you suddenly appear.
Okay, I will, but I'm going to be paying attention to what you say as my priority.
You already know my story. It's okay. All right. So thank you all for having me here tonight. I also would like to acknowledge the traditional owners of the lands in which all of us meet here today, and pay my respects to elders emerging, past and present. So what I'm going to talk to you a little bit today about is my journey. And I guess the reason why I'm talking about my journey is to kind of explain to you how digital health careers are founded, which is they're not a linear sort of process. It's quite a convoluted process at the moment, but you know, people like Louise and I are working on trying to make these actual career paths for people. But I want to talk a little bit about some of the challenges that I've had along the way, and just some of the thinking that's led me to where I am today. So I sort of see this as, you know, I went from scrubs to suits, and I say that, but I still wear scrubs some days, and I wear suits other days, and some days I'm prescribing medications, and other days I'm dealing with data, and it is a really varied career, and I'm so lucky and blessed to have found this space, because it's really my home and this is my tribe. So hang on a second, let me just see if I can get this technology working. Okay. That's it. I'm not saying I'm Mother Teresa, but what I am is I'm a connector. So what I do is I don't necessarily feel like I make all the impact, but a big part of what I do is actually connect everybody else and kind of cast the stones that cause the ripples. And this is the great thing about what Louise presented before about this ecosystem. You saw how many different organizations and bodies and companies were on that slide. And the real exciting thing about digital health is that it allows you to look at things from a system level and be able to connect things. And I think one of the big transitions for me from a clinician into the digital health world was I realized how narrow our scope is when we work in healthcare. We think we work in a big hospital that's, you know, a tertiary level hospital, and we've got every specialty under the roof, and we think that's huge. But it's actually such a small part of the health system. And the health system, which I used to think was a hospital and a GP clinic, and I had to decide between the two, is actually, that is not where health begins and ends. There is that whole ecosystem that Louise was talking about, and in digital health, you get to touch that. And just to give an example that Louise wasn't sort of making that up, these are some of the companies that I've worked with in my digital health career. And you can see they're hugely varied. If I thought about myself just as a GP, or if I'd worked in a hospital setting, I probably on my resume would have had a couple of different area health services or local health districts on there. I might have had a few GP clinics, but I have a very colourful resume, as you can imagine. But I have, you know, lots of different parts of the health system on there. So I have insurers, I have government, I have technology companies, you know, Google, Telstra. I mean, it doesn't read like a true sort of doctor resume. And a lot of these organizations I've done consulting projects with, or I've actually been employed by. And it's been a really interesting experience, because when you've been employed by some of these organizations out of healthcare, you realize some of the failings of what we do with people that we employ in the healthcare system and how we treat them. And so it's been a real wake-up call for me to understand, when you look outside medicine, there are lots of things that we can learn from that. And also there are things that we can take from healthcare outside. But I've certainly had an experience where I want to come back and make a difference to the way we look after our doctors and our other healthcare professionals. But this is an example of all the things that I've done. And Louise can probably attest to this, because she sometimes hears about my days, but they are so crazy and wild. And, you know, I think about today, this morning, I sort of started off the morning trying to figure out what kind of digital systems we use to manage COVID in the community here in New South Wales. And you go from that to, you know, wearing my AMA hat and, you know, talking to the AMA president, trying to solve things there. And then I go from that to working on digital COVID vaccination passports for opening the borders for the Department of Home Affairs when they decide to let people back in. And then I go from that to listening to a health tech startup pitch to me and ask me for funding. And then I go and, you know, potentially have a meeting with Louise and we talk about our venture fund. And so it's such a varied day. And then I might have a couple of patients who are hassling me for things like uploading their vaccination certificates onto the AIR in the middle of the day. But, you know, this is kind of I guess the breadth and the richness of what I get to do. And I never in a million years would have expected that when I went into medicine. And so, you know, when you see sometimes like memes on Instagram, you say what, you know, I think I'm going to be doing, what my parents think I do and what I actually do. I don't know if people have seen those. I try to make one of those, but then I realized I actually do all the stuff that I think I do and people think digital health is about. You know, this is the cool stuff that we get to play with, and we get, I mean, there is some boring stuff like going and reviewing EMR implementations, because as I was mentioning to you, Sue, before, I've been involved in some of those. It might not be as exciting as this, but, you know, we do get to play with a lot of toys, a lot of gadgets, and, you know, you get to really be forward thinking about what are some of the future innovations, what are the problems we can solve, how can we solve them? So rather than focusing on the here and now and what's wrong and what's broken, you really get to be creative and use a part of your brain that probably during medicine kind of died out a little bit, when you kind of, everything was very prescriptive about what you should do. And so it's nice to be able to create solutions and use my problem solving brain for solving big problems at a system level, and not just for an individual patient, which I still, you know, I still do, and it still means a lot to me to see a patient, but I also love having an impact on a larger group. And just going back a little bit on my career, I had a lot of trouble deciding what I wanted to do in medicine. I'm one of those people that sits there with my kids and we spend 3 hours spending quality time together. And we realized all we've done is watch trailers of about 15 different shows and not landed on something. And that's how I felt. I was like with my career, I just kept going, oh, I want to do this, I want to do that. And everything was exciting, everything I thought I could be good at. Don't know if that was actually true, but I believed it at the time. And so I went on this really interesting path, and people say to me, how did you go on the digital health journey? And, you know, can I learn from you? And people like friends might have seen this slide before, but this was actually my journey, and it was not straight, and you can't copy it. So you got to create your own. But, you know, it was interesting that there was not a pathway, and we really had to create our own journeys. Louise too, this isn't just for doctors. But it lands you in some interesting places. And I always like to show the next slide because it makes me feel cool. But I actually got an invite to go and meet the Royals when they were here. And this is where, you know, doing crazy things lands you in interesting places. And I don't know if they're really cool anymore. And I might have to take this down because, you know, I know a lot of people have differing views about the Royals, but had a lovely opportunity to have drinks with them when they arrived. And it was the day that she announced that she was pregnant. Megan, and when I went to meet her, you know, I said, wow, this morning you announced your pregnancy. And she said, yes. She said, have you got kids? I said, yes. She said, oh, what's your son's name? And I said, his name's Archie. And she was like, oh, that's a beautiful name. And then she named her son Archie. So I would like to say that I might have had some contribution to Meghan Markle's child's name. And I tell my son this all the time. Who knows if that's actually true? But anyway, this is the kind of interesting things that you end up doing. So I want to talk a bit about my journey because that wiggly map probably didn't quite explain what actually happened. So I started off as an intern like everyone else, did my residency, wasn't really sure what I wanted to do. So as crazy things you do, you go and join the Defence Force. I don't know why I did that, but it was fun at the time. And I thought I'd learn a lot and I would, you know, get to wear a uniform and, you know, anyway, so I did that for a little while and then kind of ended up doing bits of ED locuming, couldn't really find my feet. And then I, you know, wanted to have a family. And back then everyone said, the only thing you can do is be a GP. So I signed up for GP training thinking, okay, if I want to be a mum, I can only be a GP, which was really sad at the time, not saying anything against general practice. And it was the right choice for me, you know, looking back now. But at the time, I very much made that decision because of family reasons. And then while I was doing it, I ended up working in occupational health for this clinic called Health Services Australia. And I was literally just doing kind of mundane medical stuff. And they came to me one day and said, look, we're being bought by Medibank. And it was the best thing that could have happened to me at the time because Medibank brought with it all these other opportunities. And it wasn't Medibank, the insurer Medibank, it was another side of Medibank called Health Solutions. And Karenz, you do some of these Bupa medicals, but Medibank was doing those sorts of medicals back then. And then one day someone came to me and said, you know, we've bought a telehealth business and we need you to help us roll out telehealth. And I was like, what is telehealth? Googling quickly while I'm on the phone to this person because I had no idea. And it really was doctors on the end of the phone. And I thought that couldn't be that hard. Let me have a go. And so I signed up to that and it changed my life. And, you know, this is the moments where I think Steve Jobs said it, you know, say yes to an opportunity and figure out later how to do it. And this was one of those moments. And I was not a coder. I was not a big tech nerd. I liked computers, but I was not somebody that was like, you know, oh my God, they, you know, excite me and I get out of bed every day for them. I literally was just like a doctor that was in the right place at the right time. But when I started that process, I loved it. I was like, wow, we're helping people. As Louise mentioned, in WA on the other side of the country in the middle of the night, and we're giving them medical care and, you know, a bit like my emergency doctor service that we were talking about earlier. I really felt like I could have a huge impact in this area of trying to provide care to people who couldn't access a doctor face-to-face. And so I grew with that service, you know, got involved in clinical governance, in sort of more of the administration tasks, but also loved talking to patients. And then I got contacted by Telstra, and Telstra, again, another moment that changed my life where they said, you know how to do telehealth. We want to set up a telehealth business, come and work for us. And I remember thinking, wow, I wonder if I get free mobile plans, like there could be some real perks to this business because, you know, in medicine, we don't get free drugs, we don't get anything. So I was like, this could be kind of cool. And when I signed on, I found out that they were doing the business in partnership with a Swiss company called Medgate, and that Medgate and Telstra were co-owning this business. And I was like, wow, trips to Switzerland. Okay, I'm in. Where do I sign? And it was interesting. I mean, I had to take, people don't realize that I had to take a huge pay cut from being a doctor to going to work for a corporate. And people assume corporates have these, you know, crazy salaries and you live this glamorous life. Not at all. Like, it really was a big drop. But you sometimes have to go backwards to go forwards. And I saw it as a massive opportunity to do something different. And I went in there as the chief medical officer, and we created something from scratch. I walked in the first day, there was a couple of people, no office, no nothing, no service, no staff. And it was the most amazing feeling to build something from scratch. And it made me realize this is where I wanted to be, was to build things, to change systems and to have a real impact. So I worked on that service, and obviously it wasn't enough to work full time for Telstra and part time as a GP. I got excited about doing something overseas. So I got together with a group of people and we funded a telehealth service in the Philippines. And so there was some crazy weekend trips to Manila and back, sometimes with my kids in tow. But you know, it was a crazy opportunity, and we built an amazing centre in Manila in the Philippines. Now services millions of Filipinos to give them access to doctors and nurses, and a great service, especially when, you know, they've got such a problem in the Philippines with weather shutting down that whole city. You know, they have crazy weather, huge floods, people can't get anywhere, huge problems with traffic, and these people have access to healthcare. So a really meaningful impact. And alongside that, I kept studying, because I was like, oh, if I'm going to, and when I was at Telstra, I took over from the CMO and became from the CEO and started to run that business. And so I went and got an executive MBA, because I thought that's what you need to be a CEO, and you don't. But it was a fun and exciting thing to do as well. And then got involved in the digital health sector, you know, became a fellow of the Institute of Digital Health, did the company director's course. So just, you know, lots and lots of energy doing all of this, but it was because I was so passionate about it. But meanwhile, I was still drawn to what was happening in medicine, and a lot of my colleagues were really suffering. And I was hearing all of this stuff about doctor wellbeing and real issues around suicide and depression. And I thought, wow, I wish everyone could feel what I feel about what I do every day and love what they do. And there's something wrong if they haven't found that. And you know, I thought, I've got to help these people, because I struggled with finding what I needed to do. And then when I was struggling in, you know, what are my next steps? Where do I find my feet? I discovered this guy, and some people love him and some people hate him, but you know, he really helped me at a moment where I was trying to figure out what I wanted to do with my life. And his name's Simon Sinek, and he brought the whole concept of why to me. And it was when there were moments where I kept making career decisions about what was I going to do next. And I was like, oh, I'm supposed to do a PhD. I'm supposed to get my name on some publications. I'm supposed to do this. And then I was like, whoa, stop going on about what you're doing. Like, why are you here? Why did you do medicine? Why did you decide that healthcare was a space you wanted to be in? So I went back to the why, and that really changed everything for me. And someone introduced me to this concept of Ikigai, which if you haven't read the book, you should. And this is, you know, a Japanese concept where they studied some people in this small village outside of Kyoto, and found that these people who lived forever, like past 100, it was nothing to do with what they ate, you know, what they, you know, their genetics. It was actually about them having found their Ikigai. So that's, you know, finding what you love, finding what you're good at, finding what you can be paid for, finding out what the world needs, and being able to be close to having all of those circles kind of met. And if you find the central point, wow, amazing, not everyone finds that, but even just bits around the edge. And it doesn't have to be one thing, it can be multiple things that contribute to you having Ikigai. So it could be that your side passion is, you know, writing kids' books, but you know, you're also an anaesthetist, and that's okay because it fills a few of those circles, but it is linked to longevity in life. And I really wanted to make sure that doctors who were coming into medicine, who were getting burnt out, were really given all the opportunities to find their Ikigai. And I looked internationally at what was happening, and there were all these things popping up like doctorpreneurs and alternative careers for doctors and innovation networks. And I thought, I need to do something like that here. And that was the formation of Creative Careers in Medicine. And some of your members who are here tonight. And so it was really just an online community to share creative journeys that people had had, and it turned into physical events, and it turned into, you know, jobs, and it turned into networking, and really changing people's career paths, and people finding a safe space to talk about the challenges they were having in medicine. And now we've grown, and I'm going to try and be fast because I know I'm trying to get through a lot, sorry. We have podcasts, we have a community of 13,000 now, and you know, across social media, and it was amazing. Now we have organisations like the AMA, the Postgraduate Medical Council Victoria. We have you know, all these different medical colleges coming to us saying, you know, what is it that you're doing, because we need to be more innovative like that. And we've also contributed to really important pieces of work. So there was a recent Australian Digital Health Agency and AMC, the Medical Council, got together to look at medical curriculums and training in digital health for doctors along the continuum of their careers. And our research from the Creative Careers in Medicine Network actually was used to inform some of that work. And so it's amazing to feel like this little community that we thought we were a small community, now a big community, can actually have an impact on the way medicine is taught and the things that are included into the future. And digital health is still a big passion area of mine, and it's still something that in the Creative Careers in Medicine Network we talk about a lot. I won't go through all of this because I think Louise has talked a lot about digital health, and I talked about medical angels at the very beginning. These are some of the companies that we've invested in as the Angel Network, and that's still growing, and hoping through the venture fund that we can fund more startups and more great innovations by doctors. And I don't want to go through the findings of this research, but I just want to point out one thing which I think is relevant to Louise's comments, and I can talk through this later if anyone's interested. But when we looked at a whole bunch of doctors, we had about 800 of them that we surveyed, we found that the biggest area of interest outside of traditional paths was digital health, yet it was the smallest area that doctors felt they had expertise in. So you can see that mismatch of between 42% that were interested and 15% that had expertise. And the issue they were finding was that there were no training paths, and there was very little kind of clear ways to get into digital health as a career. And this is why it's so fantastic what AIDH are doing. And Louise has only mentioned one program, but there's all sorts of other things that are going on around digital health fellowships and digital health foundation training courses. And there's the certificate of health informatics of Australasia if you're interested in becoming a certified chia, as we call them. And Karen's just recently was probably the most recent chia that we've got in the group there. And so it really kind of shows that there's a growing interest in things outside of, you know, the clinical practice specialty that people are in, and digital health is definitely one of those interest areas. I won't go into this because and I think COVID's been a really interesting thing, because a survey we took pre-COVID and then post-COVID, as Louisa said, AIDH has exploded. So has a number of doctors that have come to me saying, I'm interested in digital health. And that's because a big part, I mean, it's interesting when I'm sitting there talking about COVID care in the community today, most of the discussion was around digital health. Like, how do we send apps out? Do we, you know, get people to fill in SMS surveys? Do we send out remote patient monitoring? Like, all of that is digital health. So the stuff that was very niche for us has now become mainstream, and it means that doctors who have an interest or expertise in digital health are in high demand. And there are so many jobs going right across the board with all those organisations I mentioned before that are super keen to have clinicians on board to inform how do we roll this technology out, what makes sense for patients, what makes sense for clinicians to be able to utilise this information. And there's huge amounts of data that's being captured. I'm just thinking now, you know, how many people are linked into, you know, the AIR and the My Health record and all the vaccination records that have gone in there, all the tests that we've accumulated. We're now going to be accumulating patient monitoring of COVID symptoms. And what are we going to do with that data? How are we going to use it to inform better care or to make public health changes? And so there's a really exciting time now where people are more willing to share data because it's giving them freedoms, being able to travel and allowing them to manage COVID. but it also means there's a massive opportunity to grab right now and make sure that as a health sector, we use that data in an appropriate way that's going to actually inform and make things better. And telehealth, you know, my passion area, we've had 15.6 million patients who've accessed telehealth over the last 18 months. And I think that's just phenomenal for something that nobody had really heard of before. And you can see Louise's quote there, because Louise and I always cross paths everywhere, and she commented on this paper as well. So just quickly, my take-home messages, which are not necessarily digital health oriented, but you know, I encourage everyone to find your why, because you can wake up every day and be super excited about what you do. But a big part of it is figuring out who you are, what matters to you, what's important to you, what constitutes work, what constitutes life to you, what your values are. But don't be afraid to try something new, because it's not a one-way street. You can always go back to being a doctor if you're worried about that, or you can always have feet in both camps like I do. And I love that, but you know, you can choose to leave, or you can choose to go back. But you know, there's a huge network out there of people who've done different things. And one thing I realized stepping outside of medicine is that doctors are not very good at networking. It's such a skill in other sectors where everyone's like connecting with everyone and you meet people to get opportunities. We don't really need to do that in medicine as much. So, because we have often paths that you just follow. But I found it's such a great skill, and it really opens up doors. And the opportunities that I've achieved over my time has been a lot because I've just met people and, you know, interesting people who've given me opportunities. And yeah, it's a man's world, digital health. Unfortunately, Louise and I are here, but you know, unfortunately, still I find myself in rooms full of men, even Zoom rooms full of men. And I think we would love to have more women in the industry. So please, like, you know, if you're interested in this area, encourage you to apply for the AIDH program, and let's get more women in digital health leadership positions, because, you know, I think we would be awesome and we need more of them. And yeah, stay in touch, join the community. That's my son sitting in my general practice, who still thinks what I do is really cool. And I hope to inspire him. But I just want to say thank you all for having me come here, and, you know, happy to answer any questions. And I know there's a lot, but there's just so much stuff that I could talk to you about all night. So thanks, Magda, back to you.
Well, thank you, Amandeep. I'm just overwhelmed by what we've been exposed to tonight, and there's just so much in the way of opportunity for us. I see George, you're there too. Hi, George. I think we met like 100 years ago at Wireless in Sydney. I'm glad to have you here as a friend. So there's a whole lot you've given us to think about there, Amandeep, and so have you, Louise. And I think the one of the things that I'd like us probably to talk a little bit about is the chia, and how that might be of some benefit to some who are interested in acquiring some extra, you know, some skill in the informatics section or in digital health. How would you sum that up for us, Louise?
Yeah, so we have we've been running it for about 7 years now, and it's called CHIA for short. It's the certified, because you become a certified health informatician Australasia, bit of a mouthful, but it's a nationally, and it's actually become an internationally recognised certification in digital health. So that how it works is effectively that there's you pay to sit the exam, and we give you 90 days and we give you a lot of reading material, and you study, or if you're brilliant, you don't study. We've actually had a couple of people, I'm like, they just got the materials yesterday. How did they do that? I found the exam hard. But anyway, maybe I'm just a bad student. But anyway, and you actually get 2 goes to complete it as well, which is quite common in industry standards. So, and then you pass the exam and you get to have the cheer letters after your name, and some of you on this call already do. For those of you, and thank you, Crystal, she's put a link to it so you can check out the website. Something else that I can let you guys know, if you have a look at that because it's of interest, but you think, oh, maybe you can't commit to that yet, or you're not sure. What we're currently working on is a foundational course. It's at the moment we're calling it Digital Health 101. I'm not sure if that will be its name when we release it, but the idea is it's that introductory. So, if you're a clinician, if you're an IT background, if you're an engineer, you can still come to this course and hopefully get some value out of it. And that won't be an exam. It'll be self-paced online learning, probably 6 to 8 hours worth. So I'll make sure that you guys are on the list and you get notified when we release that, which we were hoping to be before Christmas. But to be honest, I actually reckon it's going to be early in the new year now.
Fantastic. Thanks, Louise. Now, some of the things that, I wanted just to sort of touch on, which you both have done really in your presentations, was, to talk about, what opportunities exist and how sometimes you can stumble into these opportunities and taking them up. What you've demonstrated, Amandeep, is that, we're good at doubting ourselves, but what you've described clearly here is, say yes and then learn how to do it on the way, because we have a lot of clinical knowledge, and for systems, a lot of what's required is actually our clinical experience now, insight and wisdom, and also being patient-centred in terms of a lot of the digital health industry doesn't seem to have that patient-centeredness with empathy that sort of that we can introduce into a lot of the systems. And I think that what you've described there is take the challenge and say yes when you see these opportunities. And clearly we know you've made it very clear to us how this is an important industry and that we're at the interface all the time. So we're probably looking at opportunities that we're maybe not acknowledging for what they are. Doctors have a terrific tendency to become really siloed in what they are. Like, I'm a radiologist and therefore I'm a radiologist. I'm a GP and therefore I'm a GP. I'm a pathologist and therefore I'm a pathologist. And yet what this is encouraging us all to think about is crossing and cutting across all the sectors and connecting them all, because until we do that, we're never really going to have a health system that serves us all across the life cycle. Yeah? So what I was going to suggest is that we open up to some questions and from the audience. So how do you feel about taking some questions from our audience tonight?
Absolutely. And again, if you finished your dinner and you're just drinking a gin, please feel free to turn your camera on.
So Louise just doesn't want to drink alone. I'm sorry.
Basically, that is the problem. I'm waiting to see that I'm not alone.
I'll be joining you at the end of this, Louise. So, Kate, was that you? Oh, did you?
Oh, Kate's on the phone, I think. She's
phone.
waving. Hello, Kate.
Hello, Kate. Okay, anyone for any questions? Hands up so we can see you, because it's a little difficult in the chat, I think. So someone asks here, the CHEER challenge is a practice exam. What's the CHEER challenge?
Oh, okay. Yes, I see. There's a question there. Yeah. So so if you're not sure whether you've committed to CHEER and you're in your 90-day period, and you just want to have a go at a practice exam and get a feel for even what the software looks like as well, because it's timed. So it's effectively an open book exam, but the timing is how it's sort of monitored. So so yes, but you can take the CHEER challenge if you also just want to get some exposure to it before you make a commitment. Hopefully it doesn't turn people off. I just thought about that as I said that out loud. I'm like, hang on a minute.
So read the material first. But I was just going to say, Karenz, you just did the CHEER. Maybe just tell us your experience as a doctor coming in to do that. Because originally, I think you probably, Louise, correct me if I'm wrong, you had more like people coming from the, say, technology industry, probably coming in to do CHEER than clinicians? Or
well, to be honest, I expected that, and that actually always, since we launched, whenever we get the data together and pull it together, it's always majority clinicians, and within the clinicians group, more doctors than any of the other clinical professions. So it's actually really popular amongst clinicians.
And so how did you find it? And you obviously weren't somebody that just got it 2 days before and then went and sat it. I know who you're talking about, Louise, but yeah, what was your experience like?
Yeah, it was definitely helpful we had in the CCIM group had a weekly catch up with Amandeep and Shane Solomon, who was helping us just guide our way through. It was helpful to have that support. I think if I had just tried to tackle the workbook on my own, I would have felt very overwhelmed, not having had an IT background, but I find it very helpful, and it's given me a lot more confidence in like approaching IT projects, which, you know, before I was feeling a bit reluctant, but now, you know, I feel like I can be confident in having discussions. So it was worthwhile just making that first step to give you that confidence to have some of the language, which you may not have had before.
And you get a post-nominal, which is always exciting for doctors. I think we like the letters. We feel like we haven't done it unless we get given something at the end of it. So it's definitely been a plus.
Yeah, yeah. So is there anyone in the audience who's looking at ways of getting into the digital health space and was here looking for answers, and is still asking or has found them?
I'm just going to put someone else on the spot. I'm going to put Trish on the spot because I know she just joined. I know you got your video off, but I'd love to hear your experience as somebody having entered the digital health world from a very clinical world into digital health. I don't know if you want to share a little bit with the group. She may not even be there. Oh no!
Oh, here she comes.
She's coming! Yay! Trish does.
Sorry, I popped out of the room to get my dinner and then
I'm sorry.
back.
I'm so sorry.
But I understand. I think the question was my experience of transitioning into the digital world as a clinician. I think. Yeah. So I think, it's tough. It is really, really tough. It's like Amandeep mentioned. There's just no clear pathway, and a lot of the time you come across health tech companies that just don't know what to do with you. You can see this huge gap that you're 100% needed, and a lot of the times you see a lot of these companies and they haven't really thought about how they're going to intersect or integrate into actual current healthcare, or is it actually going to be useful in clinical practice, or actually if there's a actual problem of which they're actually trying to solve. And so it is really hard to navigate that field about trying to sell yourself to say, look, I can provide a lot of information and a lot of insider information, but a lot of guidance and navigation. But a lot of people still don't realize the impact of that. I guess just like what Corinne and everyone was mentioning, yes, it is a male-dominated field, and that is a challenge as well. I think definitely femtech companies are more willing to kind of speak with me and to get my opinion, especially because I do a lot of women's health. I guess it also is a challenge because a lot of companies don't fully understand how important it is to keep your finger on the pulse and maintain your clinical practice. They want you to do 5 days full-time work. And I guess they don't understand that when you get pulled away, you don't get to understand what the patient wants. You're not at the coalface, and you also lose your network. And so I've been really trying to advocate for job sharing and things like that amongst a lot of the startups and health tech companies that I've had discussions with. But yeah, a lot of discussions, very early days, kind of a few glimmers of lights, but yeah, that's where I am at the moment.
Great, thanks. Thank you. And sorry for putting you on the spot. Your talk was so good that you did the other day.
No worries.
Sue, do you have a question there or something?
Oh, it was just, it seems very ironic that here we are in medicine saying how difficult it is to arrange job sharing in some other industry. As a surgeon, that sounds like the funniest thing in the world. It's probably not so much for GPs, but we are quite good at job sharing in health, aren't we?
Yeah.
Well, it's interesting that one of the you were talking, Amandeep, about how you found that doctors aren't as good at networking as people working in other industries are. And one of the Stanford research surveys that I looked at on women in the digital health space, the men who were in the survey suggested that they felt that the reason that there are so few women in the digital health sector is because of the work-life balance, which you've clearly demonstrated is not the big block or the big obstacle. And the women who responded in the survey didn't say that. They said that it was access to networks and the gender bias or the stereotypes that people expect to interact with and ask questions of, and that it was that was their biggest obstacle, not that it was the work-life balance thing. So so that's quite an interesting take or insight into what that might also mean. And it comes back to what you were saying about networking, Amandeep, and providing these platforms and opportunities for us to really build a tribe, as you described.
Yeah, look, I mean, I absolutely agree with you. I think it's been, I mean, obviously medicine, you have your kind of gender issues, but I found in general practice, there was obviously a lot more female GPs coming through. And then when I entered kind of the corporate sector, I did find it a lot harder to, like, I felt like I had to work harder to prove my worth. And there was actually a job, and I won't mention which company, and I've worked for so many companies, so you guys won't guess what it was, but it was a company that I worked for that by accident, I got forwarded a HR email that wasn't supposed to come to me. And it was after I'd had an interview. I had a couple of interviews with that company, and it said, she's not what I pictured for the role. You know, I was kind of expecting a man with white hair who was a professor, and it actually had come back to me, and I was like, whoa, I could do a lot with this. Obviously didn't want to name and shame the company, but it did make me think that, you know, we do still have a lot of, you know, sort of biases, unconscious biases or conscious biases that are present in that world. And I think it's great what Louise is talking about here with her, the AIDH membership. But I think part of that also, Louise, is Louise heading that up. And, you know, having female role models is so important in this sector, and which is why I love seeing, you know, and I've been following Trish and I've been following Karen's, and, you know, people came to me a while ago and watching them kind of blossom in this industry. And it's so fantastic to watch, because then you just inspire more women to go, it's okay to be there. And that's what we really want, is just, you know, being something that you can see and that you can aspire to. So it's definitely possible. It's just a little bit more challenging, but it's, you know, people like Louise are changing the tide. So I'd say it's not, if you've done it through medicine, you'll do it here as well. It's not like it's any harder. It's just another challenge.
Yeah.
Mm.
Fantastic. And we're building a network. You've actually provided us with, you know, you've done a lot of the groundwork for us here in Australia to, which, you know, thank you, Louise. This is going to also provide us networks, and you too, Amandeep, internationally, because the thing is, one of the beauties of this whole industry is that if you do something right, or you create a system that's effective, you can apply it elsewhere. It helps many more people than just, as you were describing, Amandeep, one patient at a time. It's masses of people, and it can be applied to different systems and different geographies. And that's such an exciting thing, to be a part of something that just grows.
Yeah, no, I agree completely. And I think I've thought a while, because it's very unusual for someone to have a CEO role or any role for 12 years. And the amount of times I've had career advice telling me, you need to get another job, because otherwise, you know, and I was like, all right, well, where do I go? Like, where's better than where I am now? And until Amandeep and I started working together on the venture capital fund, I hadn't found anything, to be honest, and why not? Because there's lots of great jobs and there's nothing wrong with all of the other options. But for me, like Amandeep, and then probably some of you who I don't know yet, but, you know, having impact at scale and influence and impact at scale is really important to me. And so you know, so even if I didn't go down this path that I sort of like your Looney diagram there, Amandeep, it's like, that was so my life. Is that, yeah, like, I think that's, for me, it's very difficult to find careers and journeys where you can be really impactful, because healthcare obviously has a lot of challenges, and the only way that we can actually succumb them and improve things is by working collaboratively and at scale. So, you know, I love giving keynotes, and one of the reasons I love it so much much is because I try to picture that even if 10% of today's audience goes, yeah, and I've encouraged them to think differently, and they're going to go back to work and do something differently, or they're going to have a conversation with a colleague, and then that conversation, those network effects that come, and I feel that it's a real privilege to be able to try and impact things at scale. So which is why I love what I do so much.
Yeah, your optimism is really infectious, Louise, and I noticed that when I first met you. When I first met you, I thought, wow, this is a person who's always looking for the answers and will no doubt find them for a lot of people, which is
with lots of others.
Lots of others, that's right.
That's right. And sorry, Lydia, have you had your hand up? Is that?
Oh,
Yeah.
yes,
Great.
that's. I just wanted to thank you, Louise and Amandeep, for your great talks and inspiring us. It's something we'd really like to facilitate in our group. If you have scholarships that women can apply for that are specific to women, we're keen for our members to become literate and accomplished in the digital world, and we'd like to have. We've been talking amongst our group about having dedicated web space so that women can find this area. And so if you have scholarships you want to advertise, we would like to help that amongst our membership. Amandeep, I think I first heard you speak when you came up to Brisbane for Ikigai with Melissa and I do, and I think you were on your way to that royal meeting, so I'm glad it went well. And again, this is a wonderful open forum. We the open forum started during the pandemic. We've just celebrated 12 months of it, and we would like to keep this on our agenda for our open forums as a regular kind of networking event.
Well, that's the idea, which was all part of that whole strategic plan at the beginning of the year about having medical women in technology and health. So we are a 100-year-old organisation, and one of the things that was, we have to acknowledge that although we talk about a lot of things as women doctors, and we have we engage in a lot of advocacy. One of the things that I found was really missing was a forum for us to talk about technology and health. And as soon as I came on board, I thought, look, there are three things I really want to work on. And one of them, of course, is medical women in technology and health, which is MedWith, a nice, simple acronym, and the climate change, of course, and the website revamp. And I think that, part of the initial part of it was also about getting initially it was really also, there are two parts to it. One of them is to help our existing members become really competent and confident with the technology that we use day to day. So from everything from, just what you can, even doing a good PowerPoint presentation or using Zoom better, about the issues around digital governance. So having a session, so the first session we had was around that in April. And that was really about informing us and getting that conversation happening. And this has been really, for me, this is something I've been really excited about since I started. And I'm so happy that it's culminated in this event. And bringing our younger members also, and I state also, I think you probably heard the podcast I did with Peter Birch on Talking Tech recently, that it's for anyone across the journey. And I think that what you've demonstrated here is that at any length of time across our journey, there's an opportunity for us to enter it. And what you've shown us is that you're there to help us, which is fantastic. And we have a whole community of medical women who are hungry to make a difference. So that's the one thing that I think that we really share as a passion, and you have demonstrated that and you live it. And when, I like the word tribe, and I think it is a Simon Sinek-ism, isn't it? Or is it maybe Seth Godin or something? But it is the tribes, and this is one of the wonderful tribes that I'd love for you to be involved with, and to see us as partners in whatever it is that you want to do and engage us there. That'd be for us a really big opportunity, because from zero, having no experience, no conversation around this, to having this as a dedicated activity and site, and so this is exciting. So.
And I think the other thing I've really appreciated is how you've shared your career stories, especially for our younger medical women, to know that, as Bev Robotham says, that careers in medicine and health are not necessarily a straight trajectory. They're like a dodgem car. You bounce off different walls and find your straight path eventually. It's not a straight line. Thank you.
Oh.
Any questions? Any more questions from Marissa? I'm really keen to hear your take on tonight and what questions this has raised for you, because Marissa here is our webmaster, and Marissa has pretty much been, well, you can tell us more about what you do and how you've entered this space with us, and all the jobs that we get you to do.
I have thoroughly enjoyed this session for many diverse reasons. I have a combination of art and notes that I'm going to spend an afternoon going through, I think. I am one of the co-chairs of the group for young AFMW members, which includes people less than 40 years of age or fewer than 7 years since graduation. So it's quite a diverse group with varying exposures, I suppose, to IT as students. I don't naturally, I have to work hard to make myself try to use digital tools. It doesn't come intuitively to me, but I did have the opportunity I did some research, and what struck me was how the tools I was using were, it was like people brought ideas of something they'd invented, and I was supposed to try and work out how to use it to meet our needs. And it really occurred to me very early on that was backwards. And if they'd only come to me 12 months ago, before they had finalized this $3 million machine, we could have tweaked it a bit to make it actually something we could use. That was when I was doing my 3 years of science research, and now I'm back to being an intensive care trainee. And I just absolutely, completely, wholeheartedly loved the comment that my time in research, and it was basic science research, but even how differently people are treated in that sphere as opposed to medicine. So as a surgical trainee one day and lab scientist the next. And, I'd really have to steel myself for the days that I was going back to working in theatre and could thoroughly enjoy my days in the lab. I also really loved the comment about, I think it was you really early on, Louise, that we don't do that. And having that, just being forward enough to share that experience, so that when junior doctors come up against that, it's taken me a decade to realize that you just don't listen when they say that.
Yeah.
You're taught to be a good girl getting into medicine. You do the right thing, you get in, you do the right thing, you get through your training. So you do what people say. And it's really taken me a while to realize that they're not always right.
Mm. I agree completely, Marissa. And Amandeep and I, and some of you would know him as well, a male young doctor who was interested in digital health and found us and got involved. And anyway, after he graduated and was working as a JMO, he was offered a postgrad at Stanford to go study informatics, and he was considering not going. And I was like, sorry, what? sorry, explain to me. And because he'd asked all his like doctor friends and doctor mentors outside of the digital health space, and everyone was like, oh, don't know about that. And you're going to go off your career track. And then where is that going to lead? Well, I'm really grateful he didn't listen to them, because he now works at Google in London.
And the second part to that story is I went to visit him at Stanford, and we went out and had dinner, and he said, I really think I should go back to Australia and do GP training. And I said, why? And he goes, well, I've got this Google offer and then there's GP training and I'm really torn. Like, what is wrong with you? And he said, but I'm afraid Australia will like disown me if I don't go back and do GP training. And his actual passion was ICU, and he wanted to kind of bring digital health into intensive care. But I'm like, then why are you doing general practice training? He's like, I've just got to have a fellowship, because everyone says once you've got a fellowship, you're sorted for life. I'm like, forget the fellowship. I'm like, go to Google. But you know, he's had so many dilemmas about it, and it just tells me there's something wrong with our system where we don't encourage young doctors to go and spread their wings and bring incredible skills and knowledge back to our healthcare system. And he's one of many doctors that have come to me and asked me for advice when they've been told by medical colleges, been told by hospitals, you know, if you leave, don't expect to come back. You know, if you want to go off and do some, you know, training in something else, you want to go and do a startup, you want to go and work in digital health, you want to work for a management consulting firm for a year, like forget it, you're off the program. And I just don't understand why we do that. They're so much more valuable to us if they bring more skills back into the healthcare system. So for anyone that is in a leadership position, if you get your junior doctors, your mid-career doctors saying, can I go off and do something, please support them, because they just come really torn. And Martin will be amazing when he comes back to Australia and does general practice training or ICU, whatever he does, and changes the world. So just a you know, some advice when you get dealt with those kinds of situations.
Well, there's a thing called virtual ICUs, isn't there? He should come and set those up.
Yes.
Now, absolutely. You could do that from over there.
Well, exactly.
Well, that's fantastic. I mean, in probably the other chapter to what you described there, Marissa, about, you know, the dilemma at early stage career, I'm at later stage career. So I'm a baked doctor. I've been in practice for 30 years. And I think, you know, I mean, Louise, you know, we've met before and you probably wondered what happened to me. What was that hiatus in my digital life for the past 10 years? And it's been about self-doubt and tying yourself up to the sort of the straight and narrow path of doing the day-to-day, you know, grind of going through your practice, and then research was another chapter, and a whole lot of other things have evolved. But that digital thing I actually let sit. And it's bugged me the whole time because, of course, you know, I was on the NETA advisory committee initially, and, you know, that was obviously the success that it is. and the PECA program, which now is the electronic health record, and so on and so forth. And then later, a couple of years ago, I decided I'd do a master's, only because I was being pushed by the department to sort of like, Magda, do a PhD or do something. And I thought, look, I'll do a master's, and I'll do a master's that's a relatively quick one. Well, what a falsity that is. 2 years, full-time online, a master's in health and human services, full-time work, full-time everything. Finished it last year. And I thought I'd sort of park the uni thing, but discovered that I love being a student. I absolutely love it. I teach, but I love being a student. So recently, the Department of Medicine at Melbourne Uni are setting up a pilot. Well, they've got a pilot project, a pilot subject, and it's applied learning healthcare systems. And it's Wendy Chapman, and it's the University of Health Informatics, the Department of Health Informatics. And you could put in an application to do this for free. And I thought, oh, well, what the heck? Anyhow, about 250 applied, and I was successful in scoring a position. So I started, I've just done my second week, and it is really hard, right? So, and we have quizzes all the time, mind you. You know, I'm with some are work for government, so it's not all doctors, but a couple of the doctors are, one's a cardiothoracic surgeon, one's an intensivist, one's a psychiatrist, one's been working for government for the past 30 years, others are 5 years into their medical career, and others are from the social work department and other sectors of the community. So what this is amazing, what I'm finding amazing, is that it's drawing all our, it's incredible when you look at a single problem like diabetes, for instance, all the different aspects of that and how we all experience it in our work life in a totally different way, and then bringing that into some sort of health care system that can improve the outcomes. And they're the big questions that we're all having conversations about. And so hopefully at the end of this whole period, I'll come out through this feeling that I'm better equipped with the language, understand the complexity of the health systems and how we can interface with them and bring our own strengths into each of those components along the way. And I think that it's about, and you know, I was a bit like the fellow that you described, Amandeep. I thought when they told me that I was successful in securing a position, the first thing I felt was dread. I thought, oh God, am I really up to it? And I'm doing it, and I'm really happy that I'm doing it. So anyone who's in that later stage of life, who's thinking, should I be doing something new or different, or should I be pushing? Yeah, give it a go. And if you want to talk about it, talk to any one of us here, because most of us are doing something like that, and it's hard, but it is also really fun. Yeah.
Thank you for sharing your own journey too. Yeah, and because it's good, you know, you can think of people at the early stage of their career and they're getting different advice, or, you know, not to get off the pathway. So thanks, Magda, to know that, you know, that was something that you also encountered even later in your career. It just never ends, does it? Like, seriously. Oh. Actually, I had a podcast that I was running for a year or so, and it was all about career journeys in digital health. And some people were really well known in our field, and other people, no, they weren't well known, but they just had really interesting journeys. And it would just be me asking them about, you know, who are you and how did you get to where you are? And we would go through that. And thank all of you, because this conversation, I let it lapse a few years back, just, you know, other priorities got in the way. And I'm thinking I need to start that up again. And maybe Amandeep, you're my first person I interview for that. And you can just retell the story you just told us. But yeah, because I think it's still such an issue for people to work our way through it. And I think there's this idea, isn't there, that, oh, you see someone in Magda's role or in Amandeep's role and you go, oh yeah, they've worked it all out. You know, they had a plan and they got there. And then it's like, it's all bullshit. Sorry, but it is. Like, it just doesn't, life doesn't work like that. And especially for women, when there are so many things that as talented and ambitious women that we have to juggle, and we just make it work somehow. So yeah, maybe I should look at capturing more of those stories.
That's fantastic. Well, do we have any questions? So with the respect to the links, Louise, so I'm hoping we'll, normally what we do is we do a write-up of an event such as this. This is a monumental occasion for AFMW. So there'll be a write-up and a link to the Zoom, if that's okay with you and Amandeep. Is that okay?
Yeah.
Yeah, on our website. And with that, we'll embed the links that you've recommended. And this is a permanent link on our website now. So MedWith is a permanent link, along with, you know, climate change and our other key working groups. And then we can just continue uploading information as you have things that you want to share with us, both of you, especially with AIDH and the scholarship programs for next year. We'll just, you know, promote them and invite you back to have another one of these sessions. And this will be an ongoing building relationship. And Amandeep, I think you've just, you know, it's certainly not about reinventing the wheel, because you've invented it. You two have brought this all together. You've created this amazing vehicle, which we just want to be a part of that with you, and participate and learn as much as we possibly can, because you've both done really an amazing job in creating a platform for us and an environment where we can connect and learn. So thank you.
Oh. I'm embarrassed now. That felt overcooked.
And Louise and I both probably have the same sort of view. We just feel like we're regular people doing our jobs, and then when people say stuff like that, it's like, oh, we're just doing our jobs. But it's great that so many people have showed an interest, and we're both very busy people, but we'll always make time if people reach out and want to talk, want to get some advice and have some mentorship. I just want to share something really funny though. I had recently a job, a leadership position, a medical leadership position that someone asked me to recruit from our creative careers in medicine community. And I put the ad out and I had about 30 people respond to it. And it was hilarious. Like, you hear this story about women who look at a job, sort of the requirements for a job. And if there's one of those things that they haven't got, they'll think they're not suitable for the job. And men will have only 50% and say, yeah, I've got it all. And it literally happened to me. Every single woman who responded back to me said, I don't fit exactly this many years of experience, or I don't fit this, and I haven't met all the requirements. And then the guys who basically had nothing on the list were all like, here's my application, am I going to get the job? And it was just such a stark difference. And I just had to go back to the women going, those job descriptions are written like, expecting that there's a unicorn out there that exists, and no unicorn exists. And I've written lots of job ads in my time, and I can tell you, they're all like nice to haves, but we'll never find someone that fulfills all those criteria. But it really shows me the big thing, that the problem that we have as women is just that confidence thing and backing yourself. And I think, Magda, you made a really good point there. It doesn't matter where in your career you are, change is always scary. Stepping out and doing something new is scary, but just back yourself and have confidence, because if you're a bloke, you would have it. That's what I'm seeing in real life, and it's great if you can be supported by communities like this where we're all kind of cheering for each other. So good that you've got this forum.
Well, thank you. I think that's a wrap up for tonight. Wow, you've blown me away, blown us away. So thank you again for your generous sharing generously your stories and inviting us to participate and just inspiring us. Yeah, more good things. Thank you. And to everybody who's attended tonight, can we take a last shot? Marissa, can we take a screenshot? Is everyone happy to show their? Great. Just switch on cameras and
give everyone a second.
Do everyone's hair. Yeah. I had short hair before COVID.
Yeah.
Everyone else is in the same boat.
Yeah. Well, this is fantastic. Thanks a lot, Marissa.
No worries. I've got a few there now.
Great. Well, I'll let you all get back to your, dinners and drinks and things.
Thank you so much for having us. This is the best way to spend an evening. So thanks, everybody.
Thanks. I agree, Louise. Thanks a lot. Thanks, Amandeep.
Bye.
Bye, everyone.